Hello friends, in this video we'll talk about some important joints of the thorax. So first here is the costovertebral joint. So these are nothing but these are also a variety of the synovial joints, the articulation surface. So just you have to know what are the type, articular surfaces and movements. That's it. Because these are not very joints of so importance. Okay. So we can see costovertebral. So what is the meaning? Here this is costal cartilage and this is the vertebra. Okay. That is the costovertebral joint. Next. So coming to costotransverse joint. So it is a joint formed by the costal cartilage and the transverse process of the vertebra. Next, chondrosternal joints. Name itself as the answer. We have the costal cartilage and the sternum. Okay, just like what we have seen in the thoracic inlet. Okay, I have shown you. Okay. These are some points. The costal cartilage of first rib with the manubrium sternum. This point I have already explained. Synchondrosis. These are all cartilaginous joints. Okay. Then 2nd to 7th costal cartilages articulate with the sternum by synovial joint. There will be a cavity except the second part where the cavity is having two parts. Okay. And interchondral joints between two costal cartilages it will be there, especially the 7th and 9th part, and along with the 9th and 10th it is ligamentous. Okay, these are all very small synovial joints. And manubriosternal, lastly we have the manubrium of the sternum and the body of the sternum. Okay, so these are the symphysis as in secondary cartilaginous joint. Okay, and the movements, they are not very significant, maybe very slight movements. If we touch like this, slight movement will happen, and they are all cartilaginous joints, synovial joints. Okay, so not very special in function. Okay, so here we have to remember this point. The manubriosternal joint is not a typical symphysis because as a rule bones taking part in formation of symphysis don't undergo union. That is, law of union of epiphysis does not come into the picture. But after 30 years, remember, the bony union takes place between the manubrium and the body of the sternum. So that brings us to the end of the video. So thank you so much. I'll see you in the next video.